Hello, I'm Dr. Ryan Maercks, and I'm reporting to you now 9 weeks after I initiated Maercks Multimodal Therapy, or MMT, on myself. Been running a little behind with time to make these videos and actually complete the treatments, so I'm behind on the treatments as well. But nevertheless, here we are 9 weeks after I did the first MMT treatment on myself. For those of you that are just tuning in, MMT, or Maercks Multimodal Therapy, is a term I use to refer to what I consider the best practices in non-invasive body contouring to treat loose skin, erase cellulite, and reduce fat. If you watch my previous videos, you'll understand that I don't believe that non-invasive treatments are a replacement for surgery, liposuction, abdominoplasty, or other body contouring procedures. The results I can get with liposuction or abdominoplasty will never be met by a non-invasive technique. But a huge population of my patients demand non-invasive techniques, so I have quite a bit of experience using them. Most of the new technologies that are marketed are very disappointing. All of them can be made to work if used appropriately, and the surgeon administering the treatment understands the technology and your body's physiology. As far as fat loss, all of these techniques are dependent on your body doing something with the energy material that's released from the fat cells, the fatty acids, triglycerides. They have to go somewhere. So there's a limit to how much cleanup your body can do. So the physiological limit is really what governs the maximum non-invasive fat loss that can be achieved. Liposuction or surgery, on the other hand, directly removes the fat from your body. So the limits are much, much higher as far as what results you can get. That being said, after using almost every non-invasive technology out there, I came up with my own system of using the technologies that I feel work best, and designing an intervention with anywhere from 3 to 6 different kinds of technologies depending on the patient's findings and what we're trying to achieve. These can include infrared light, lasers, the 1064 Nd:YAG laser I commonly use in this treatment, different kinds of ultrasound, different frequencies and polarities of radio frequency, and some other techniques including infrared light that can add to the results. So what you're all waiting for is, what is the result here at 9 weeks? So at 9 weeks, I feel very confident that the effects of my original treatment are here. 6 to 8 weeks is really when you get the most benefit from the first treatment. And I've treated myself 3 additional times. Again, this is a more rapid rate than I advise for patients. One single treatment can be very efficacious by 6 to 8 weeks on certain patients. Other patients may require repeat treatments or little tune-ups, but using an accelerated rate of treatment isn't necessarily going to give you a better result. The closest I like to put them together is 2 weeks for people aggressively looking for results, but I advise for about 4 weeks apart if we're going to repeat with a package type treatment. Again, any questions that come to me via this blog, YouTube, Facebook, or directly on my website will answer expeditiously. And I hope you find this video blog educational and beneficial. The idea is to convey to the public what kind of expectations are reasonable if you get the best of all treatments in non-invasive treatment. After I conclude the exam, which we'll go to right now, we will update. I'm going to give myself another month for everything to settle. I'll do an update then. Then after that month, I'm going to do a single treatment on the left side of my body and see how we catch up. I hope you enjoy the video, and let's go to the exam. Here we are in the exam, and again, we're at 9 weeks after I initiated MMT, or Maercks Multimodal Therapy, on the right side of my body, leaving the left side of my body alone. I've also been on a relatively high protein, low carb diet, and I've done minimal exercise due to my neck injury I sustained a few years ago. I'm trying to look for ways to get back into working out more, but I've done some cardio and kind of just shifted my lifestyle slightly. I've lost about 10 pounds over the past 9 weeks, obviously from both sides of the body, but I think at this point the skeptics can see for sure there's a pretty dramatic change to the right side of my body that hasn't occurred in the left side of my body. And most of the obvious changes you're going to see are this sharp definition of my lateral abdominalis and this kind of more fatty appearance on this side with loose definition. To try to be as fair as possible, I'm going to lift my arms about the same height, try to equalize everything, and you'll see this definition here. And I'm going to spin for you before I do any marking so you can judge for yourself. You can see the kind of cellulite appearance in the fat roll on my left side there. You can see the loose definition over here. You can see more defined and kind of a six-pack appearance, nice clean oblique with no cellulite appearance. And you have to turn way back here to see a little bit of fat roll back here. So I think that's a pretty darn dramatic change for non-invasive treatments. I know you already see this, but just so we can clarify what we're talking about, I'm going to trace this, sharp line that we're seeing now developing here. I hope you can see that here and here. Hopefully you can all see that. And then let's go back to what I've been pointing out since the start. This fat pocket, which I hope you can clearly see this. You see the shadow here, I hope. So this is kind of the borders. You see the shadow here of this fat pocket that's hiding my abdominal definition. Here I'm drawing in the mirror again. Something like this. So hopefully everyone can see that. And then if you look over here, you're starting to see this sharper definition here, and kind of this fat pocket that's taken on this shape. And I apologize for the squiggly lines, but it's not that easy to draw in the mirror. If I lean back and try to give some more tone to my abdominalis muscles, you'll see developing right here, maybe if I stand back, right here you can see a line here, and I'm failing to see any line here as far as definition. So you can see that sharp definition, that shadow, this sharper border that of course moves immediately when I lean back and flex, that gets to more this point. But you can see this kind of definition coming in, giving kind of three discrete muscles, and of course up here. And over here, I can't do anything here because I have this ball that looks like it might be muscle, but it's fat. And then a loose shape here, and then there's a pretty good line there. But it's kind of really poorly defined. And then when we look over here, I hope that, I'm going to step closer, I don't know if you can appreciate, again, the cellulite kind of appearance here. And then if I turn around here, it's really gone. All you see is some serratus shining through. And then back here where I can't treat myself, you can see there is a little bit of cellulite appearance. And you see this tiny little fat pocket here. Hopefully you can see this tiny little pocket. When I let go, you can see its definition. And then if we go over here, there's still quite a robust chunk of fat roll that goes all the way across here. So, before we drew that, I could draw that again, something like this. And then if we go over here, I have to grab it way back here. So I guess I would do something like this. And that's a dramatic change. I think when I started, before I started a little bit of diet and exercise, it traced it probably out to about here. So it's retracted a little bit, but this guy you can't even see from the front. So if you look carefully at my silhouette, you can see that this is just a filled in space of chunky fat and kind of some cellulite appearance here. And if you look over here, there's this stuff back here I can grab, but when you look up front, it's just skin. See how thin this pinch is? So I hope that has you pretty convinced there. And then what else was I going to show you? Just generally looking, if we just generally look at the pectoralis, this looks a little tautic, and you see some ripples, kind of cellulite appearance over here, and this fold here is ill-defined. It has like some cellulite shadows, and it really isn't a sharp definition. And I'm trying to put my hands in the same position. Someone commented that maybe my hand position influenced what we were seeing. But if we look here, it really is a sharper definition, and even up here it looks fuller, and it's not because somehow I've managed to work out one pec. That would be difficult. It's just the skin is tighter here and makes it look full and more masculine. And here I look like a little bit more of an aged body, and hopefully you can appreciate these shadows here, kind of the cellulite appearance over here, and you can appreciate that it's not here. The serratus definition is probably a little different, so you can see the serratus stripes here, and over here, well, yeah, it's very different. You can kind of appreciate them, but more you appreciate these little fat rolls. So to recap, what we see after 9 weeks, and I usually tell my patients between 6 to 8 weeks, you see the final results of the first treatment, is that we have greatly increased abdominal tone, kind of the six-packs coming through. We have low abdominal tone, the stripe going down right here, and I don't know if there's a way to show you, but if I look down, I see a big pooch here, and I don't see a pooch here, which is kind of cool. We talked about the fat pockets. We talked about what I think is the most powerful part of skin tightening and MMT. It's not the fat loss. Of course, as you see, there is fat loss, very significant fat loss in problem areas. But it's really the definition that we create over the muscle to make a very natural body form. And the most impressive thing, I believe, is that I can totally eradicate cellulite, make it totally go away. Of course, the results are different depending on the severity of the condition of the patient at onset of treatment, but I think this is the best demonstration here. You know, even stepping back, you can see just the ripply appearance, and then when I do the same thing here, it's just clean like baby skin. And I tell patients all the time that when they come in and are asking for fat reduction, a lot of the time that's not going to serve them well. If you have loose skin and you have some subcutaneous fat, and I take out that fat with a non-invasive technique or liposuction, it's going to make the appearance of the loose skin and cellulite worse. Whereas if you leave the fat alone and get some significant skin tightening like we have here, I still have fat underneath here, but it's healthy fat. And the tightness of the skin and the sculpting I've done show muscular definition, even though there's some fat there, and the skin looks beautiful. If I was to not tighten the skin and either non-invasively or invasively just remove the fat, the skin appearance would worsen. And that's one of the nice things about MMT. I can tune the treatment to reduce fat where it's necessary, like in this area and this stubborn pocket of fat here that's taken quite some time to go down. And I can focus on aggressive skin and deep tissue tightening where it's needed. And this is kind of the art of doing this. This is one of the reasons I commonly say forget about a brand name treatment, forget about the latest technology you saw in the magazine. Focus on the doctor. Find a doctor that can understand your concerns and has the judgment and experience to get you there. Because I use many brand name machines and many machines that are just excellent technology that aren't really marketed in the aesthetic world. But it's my judgment and experience and knowledge of how to use these in an artful way that allows me to get great results for my patients. I hope this has been educational. I hope that you walk away realizing that yes, skin tightening modalities used appropriately can work. We can get rid of cellulite, we can tighten skin, we can reduce fat. But again, if I was to do liposuction, if I was to receive excellent liposuction on myself 9 weeks ago, man, I would have really a ripped look. I wouldn't have any fat here. My waist would appear narrower. So I want people to take away that non-invasive techniques are not replacements for surgery. Surgery, well executed, well planned by a surgeon with good technical skill and good judgment, will always trump these machines. But for patients that totally rule out surgery or patients with minimal findings, minimal fat, minimal skin laxity, the non-invasive approaches of MMT are an excellent option. Again, any questions you post or send to me, I'd be happy to answer, either directly or on the video blog. I hope all the questions from the last series have been addressed in this blog. I will return to you hopefully. I haven't been good on keeping them scheduled, but one of the a piece of good news that's partially responsible for that is this week we're moving to the newly built Maercks Institute Surgery Center on Biscayne Boulevard, right outside the Design District. So we're really excited about serving our patients from that location. And it's season in Miami, which means I'm busy. So I hope, I want to wish everyone a Happy New Year. Sorry I missed it with the scheduled blog update. I hope you enjoyed this, and we'll be back to you in a month or so showing the final settling of the right side and initiating treatment on the left side. Thanks for tuning in.